it was the hardest part because unfortunately that doctor didn't understand. She said, you can't be with your child.
So many women struggle and they just, instead of seeking help, they think 7 times what this doctor will think of me, what will my mom think of me, what will mother-in-law think of me, what will my husband think of me.
Husbands are neglected. They need someone to ask if they're okay because they're not always okay.
We know from evidence that 10% of husbands of women who struggle with postnatal depression, they have postnatal depression themselves.
Yeah. Obviously my therapist helped, but it was me.
Of course.
I had to do it. No one was going to fix this. Hi, I'm Catherine, and today I was speaking to you about my experience with postpartum OCD.
أهلا وسهلا بيكم في حلقة جديدة من بودكاست كلمني عنه. النهاردة حلقة مختلفة جدا. حلقة جالنا أسئلة كتير عن الموضوع ده. كتير جالنا أسئلة عن الوسواس القهري. إزاي الواحد بيبقى trapped بأفكاره، حاسس إنه محاصر بأفكار وبأفعال قهرية، وحاسس إنه في دايرة فعلا مش عارف يطلع منها. وده مش مجرد إحساس، دي تجربة حقيقية جدا للشخص ده. فالنهاردة في بودكاست كلمني عنه فكرنا نعمل حاجة مختلفة. مش بيقولوا اسأل مجرب ولا تسأل طبيب؟ النهاردة قررنا نجيب المجرب. النهاردة ضيفتي حد عايش مع الوسواس القهري، حد تعافى من الوسواس القهري، وحد النهاردة عايز يشارك التجربة الفريدة من نوعها اللي هي عدت بيها. النهاردة ضيفتي مش بس عانت مع الوسواس القهري وغلبته، لكن كمان عدت بيه في مرحلة ممكن تكون مرحلة تحدي لعائلات كتير. كانت أم جديدة لسه مخلفة. النهاردة هي معانا عشان تتكلم عن تجربتها. أتمنى أن النهاردة حلقتنا تعجبكم، وشاركونا بكومنتات أكتر. عايزين تسألوا مجرب ولا تسألوا طبيب؟ معاكم دكتور مادونا ياني، استشاري الطب النفسي، وضيفتي النهاردة كاثرين. هاي كاثرين.
Hi, أنا اسمي كاثرين.
That's good. How old are you?
Oh no, I've forgotten how to say it.
Because you say 5 always.
Yeah,
because
yeah,
your daughter
5.
told you that, right? Lula says أنا عمري 5.
Yes, that's it. That's exactly what she says, yeah.
Catherine, thank you so much for being here today. It's amazing. It's a privilege, really, to have you today. In the intro, I was saying, we have a saying in Arabic that you should go and ask people with lived experience. Don't ask doctors.
Yeah.
Like, there is a wisdom in living with quite serious mental illness for quite some time of your life. And I can't thank you enough for being here today.
Well, thank you for inviting me. It's an honor to be here, and I'm excited to talk about it.
Oh, thank you so much. So, Catherine, we have received dozens of messages on daily basis on the podcast about OCD. How is it different from anxiety? What's happening? I did episodes and episodes about the science behind it.
Yeah.
But I think no one can tell us better than you who lived with it.
Yeah.
So, is it okay if you share with me the first time you noticed, something is happening with my mind, the ruminations, the obsessions, and how did you handle that?
Yeah. I mean, I guess I was 18, but I thought it was health anxiety, not OCD. So it was very much, I was terrified of being sick anywhere that I went, and I was scared of dying. But it was always like, if I had a symptom, I'd have to Google it. I'd have to think about it and have to try and come up with an answer, because then that made me feel better. But then it didn't really make me feel better. But it wasn't until after I'd had my daughter that I started to have the thoughts that scared me and that were different to like my body and symptoms. And so my daughter was 5.5 weeks old, and I was just sat with my husband watching TV, and then suddenly a thought popped into my head, and it was like, what if you throw her? And I was like, oh.
So scary.
Yeah, I was terrified, because I don't think I realized then that my thoughts weren't always me. To me, I could control all my thoughts. And I think with learning through this experience of having it, that I realize I thought I could control all my thoughts since I was 18, since I had a health anxiety. And yeah, so that was the first thought that I realized that something was slightly different, and it just snowballed from there.
So it started when you were 18 with anxiety about your health.
Yeah.
Which is, again, something very common, that people move in the anxiety spectrum.
Yeah.
People are afraid of getting ill, then they might be afraid of flights or heights, but then it's very unique what happened with you after delivery.
Yeah.
When your daughter was 5 weeks old only.
Yeah.
And you got the thought, quite scary thought. Was it just thought, or was it image and urge?
The first thing was just a thought. It started as a thought, and instantly, as soon as I had it, my body went into panic, and I gave it to my husband because it felt it almost felt like it could be a tick, or like that I was going to do it, even though it was just a what if you throw her. And then as the day, like before I seeked help, it was only a couple of days from having that thought that I felt really scared by it and needed to seek help. But I then started to see that image happen. And so it very quickly got worse. It became quite severe. And the thoughts got worse, and they just picked up on my other daughter, my husband, people that I was walking past. And it just, my brain just stuck to everything, everything, yeah.
Of course. And I imagine, so you gave the daughter to your husband. I imagine a lot of feelings must have been happening inside of you. Do you want to tell us more about how did you feel at this moment? How was it easy for you to spot that this wasn't going to happen, or?
No, I gave her up. I gave it to my husband because I thought it could happen, but I didn't understand why. So when I gave birth to my first daughter, this was my second, I instantly loved her. There was this, I remember writing in a diary when she was 12 weeks old that she was my soulmate. And I just felt this powerful love. And I had felt that for my daughter, but as soon as that thought happened, I started to doubt everything from that moment. And I now know that OCD is called the doubting disease.
It is.
But it made me doubt everything. And I almost, from that moment, forgot the last 5 weeks of being in love with my baby. And I know it doesn't come immediately for some mothers. But yeah, I think there was just panic in my chest. And I just wanted to keep her safe from me. It suddenly felt that I was going to be a danger to her.
I'm so sorry that you passed through that. I imagine, and I remember actually that time. I remember the worry, the pain, the thoughts, the overwhelming experience. And again, being a new mother in itself can be very overwhelming.
Yeah, the tiredness, the sleeplessness. I was also very scared of her choking on our milk. So I was bottle feeding her, and she kept choking a little bit on. So that was a big worry, and that probably didn't help the thoughts. And I didn't want to feed her, but I didn't want other people to feed her because I wanted to be there in case I could help her. I think there was already a lot of anxiety as a new mother, even though this is my second and you've got a bit more experience. It had been 4 years since I'd had a baby. So it was like it was brand new.
Wow. And then what happened? How did you come to realization that, okay, I need help?
So I think that was on the Saturday night that happened. And then I had been anxious before, but I actually forgot. And it wasn't until I reread just I kept a diary of just like having a baby, what the birth was like. And it wasn't until looking back that I realized I was very anxious, but about myself, about like postpartum health. Was I bleeding too much? Was my baby, was she drinking? And there was like, about her and me, there was lots of thoughts. But from that Saturday night, the Sunday was filled with more thoughts, and it was quicker, it was constant. So I didn't really want to handle her too much because I was scared. I said to my husband, I think I need to go to the doctors. And I had been to a doctor and she'd said maybe some anti-anxiety medication might just help this period of time. So I was like, I'll just go and I'll just maybe get some meds and that'll, but I'd never had it before.
The medication?
Even though I'd been anxious.
Since you were 18?
Yes, I'd had therapy, different types of therapy. I'd tried hypnotherapy, CBT. But this time I was like, just as almost like a quick fix, I was like, we'll just go. And so very quickly it felt like I needed help. But it felt so different to any other anxiety that I'd had in the past. And I think that's what made me go quickly to go and get help.
Is it the intensity of the anxiety or the timing that you were a new mom, or a mix of both? What do you think?
I think a mix of both. I think it was probably the timing, but it was the thoughts were just nothing like I'd ever I'm not an aggressive person. I've never harmed anyone. And suddenly I was having thoughts of, what if I harm my baby? And I was like...
And you're already a mom, you know what is it to be a mom to a baby? It's not your first baby.
Yeah. And I think it was almost, probably from the lack of knowledge of knowing that OCD was unwanted intrusive thoughts that made it more scary.
Yes.
So because I just thought, even though I've done a degree in psychology, we did not touch on OCD. So in my head, it was hand washing. It was having to flick the light switch 10 times. Those sorts of things were in my mind, naively.
True.
So because I didn't know that it was thoughts mostly that causes even those things to happen, and I was having no symptoms physically, they were all in my head, it made it scary because I just thought there was something worse happening to me.
What did you think was happening?
I thought I was psychotic.
Yeah. So you thought that you're in complete detachment of reality.
Yeah.
That you might be hallucinating or at danger.
Yeah.
But thank you for highlighting this, because OCD, even when we study, like people who study counseling or psychology, it's something often neglected in healthcare, and I'm sorry for that.
It's not your fault.
In the name of all healthcare systems. Because it's, even in movies and media, it's always portrayed as someone who's, just wanted things to be symmetrical. Right? Or, in these movies where like you see a lipstick on the glass and, it's dirty.
Yeah.
Or someone washing a lot.
Yeah.
But it's rare that we see how it can be a thought that is unwanted, repetitive, quite distressing, scary. It can have different themes. It can be religious themed, it can be sexual themed. It can be, especially with new moms, something about the health of the baby, their own health, or even being something so much away from my nature as a kind, supportive mom, just seeing myself as being a danger and a harm. OCD has so many presentations that are often neglected. One of the interesting Egyptian shows years back, I was so happy that this finally came on TV. It was a mom who started to be very preoccupied with the health of her children. That she wants to shield them from the world. So she started to, make sure the feeding habits are different. She started to not allow them to go out, even not allow them to go to school. And it deteriorated even more and more in that show. But it shows how not seeking help, people feel trapped. They feel, I'm dangerous. They feel, I'm bad. I don't know. Can you tell me more about your own experience, your own feelings, and how did you, after help, how did that change for you?
I don't know how I understand why people don't seek help. So it was very scary because I had to go in and say to a doctor, I'm having thoughts of harming my child.
And it's never easy to say those words.
No.
You're very brave, Catherine. I have to say, you are.
Thank you.
You are.
Yeah. I think that was the hardest. It was the hardest part because unfortunately that doctor didn't understand. And so she said, you can't be with your child
Immediately.
Yeah. She said, we can't let you leave with your child because we think you are a danger to yourself or to your child. And I remember being like, I am going to hurt her. And because it suddenly was like, oh no, like what I'm thinking is going to happen. When actually, when I saw you, I got to you and you were like, you're not going to do these things. And I didn't believe you, even though it'd only been a couple of days. So I can't imagine what it's like for women who have gone through this for weeks, months, and not understanding fully. But it had been days for me. And you were like, you're not going to hurt
and
your
you were
baby.
already exhausted.
Yeah.
Very exhausted.
Yeah. Yeah. And I remember just being like, really? But how do you know that I'm not going to, like, how is it okay that I can leave here? And you were like, because I know hundreds of women have said the exact same things as you're saying now. And I remember being like, really? And I did go home and look at perinatal postpartum OCD and read the exact thought of what if I throw my baby. I read it from other women and I was like, oh, what? And I think it was just like for me, research was the best thing because I bought a few books and again, I was reading the exact thoughts that I was having. And I was like, oh, okay.
Wow.
But it took like 3 professionals.
To get the right diagnosis.
Yeah, and to also say, this is OCD.
Yeah.
For me I said to one of my psychiatrists, I said, I didn't believe you. And he was like, I know you didn't.
Yeah,
but he was like,
of course.
I do know what I'm talking about.
Of course.
And I was like, but my brain tried to tell me otherwise.
Yes. And that's a tricky part of OCD.
Yeah.
So just for our listeners to understand the difference.
Yeah.
As you rightfully said, hundreds of women after delivery, they start to get obsessive thoughts, whether they had a past history before or something new happens after the delivery, that they start to get these thoughts, unwanted thoughts, something very unlikely to themselves, something that you could see the person in front of you in distress, in agony from the thought.
Yeah.
Something in psychiatry, we call it ego dystonic.
Yes.
So the thought is not really something that I agree with.
Yeah.
I
it's
think
against your beliefs.
It's against every belief, not only belief, it's against every part of my
of
body.
yourself.
That's why my body even not
Yeah.
happy with it. I'm taking actions to prevent it from happening.
Yeah.
Unlike psychosis, which can also happen, postpartum psychosis, which happens in every 1,000 deliveries or live births. So we're talking about 1 woman every 1,000.
Yeah.
That can have thoughts. But again, a very technical term, we call it egosyntonic.
Yeah.
So it's more of something that I genuinely believe.
Yeah.
I believe that my baby is possessed, or I believe that my baby is harmed. And I believe I need to take an action, might harm me or might harm the siblings or might harm my husband. Like it's a thought that again comes with a sense of belief.
Yeah.
It's I think the word you said, the belief in
Yeah.
it, and the distress coming from it. That stress that how I'm thinking that, in opposite to you don't believe me because you don't know. I know.
Yeah.
And in fact, in all of these cases and these experiences, women get misunderstood a lot.
Yeah.
And I think that's what pains me the most, that as a healthcare system, we affirm something that all these women I have seen agree on, that they are amazing moms.
Yeah.
If they have the right tool, the right support, they are amazing moms, amazing wives, amazing women.
Yeah.
Who just need help.
And they need the people to, like, they need to be able to go and ask for help without being scared.
And without being judged.
Yeah, definitely.
Did you feel judged at some point in your journey?
Just the first, no, I didn't feel judged. I just felt not by the doctor, I didn't feel
Yeah.
judged. I felt misunderstood.
Yes. Okay.
Looking back, I guess I felt misunderstood. But maybe I think, you know, by society, I might have felt misunderstood and judged because the thoughts I was having was of harm to my baby and me doing the harm, like not accidental. So I think if people don't have the knowledge in that thoughts aren't you and that they're separate, then yeah, you're gonna feel judged. But if more people can realize that you aren't your thoughts and that they're separate,
Yes.
then there'll be a lot less judgment. I think it's just more people understanding. I think I'd read that it's called pure all
Yes.
because it's all in your head. So I had no physical, what's the word?
Yeah. Yeah. And that's what makes mental health struggles
Yeah,
difficult.
Yeah.
Because it's a struggle.
yeah,
And it causes a lot of mental battles and physical health sensations. But to the other person, it doesn't have to be validated for
Yeah.
some reason,
yeah,
which is wrong. That's why we're here. That's why thank you for being here.
yeah,
Because I'm sure so many women struggle.
yeah,
And they just, instead of seeking help, they think 1,000 times of what this doctor would think of me, what would my mom think of me, what would my mother-in-law think of me,
Yeah.
what would my husband think of me.
yeah. I was terrified about what luckily, and I don't know how he felt it, but when I was telling him these thoughts and they got worse, and I just kept, because I wanted him to say, I wanted him to be like, oh, it's okay, you're not going to do this. But he was my reassurance. That's how I was reassurance seeking. But he just was like, "This, you're not going to do this." And I was like, I don't understand how you can. He was like, because I know who you are. But not everyone would be like that.
Yeah.
And not everyone would be that understanding. And I think that's probably quite scary. But if I'd read about or heard about my experience before, it wouldn't have been as scary, because I would have been like, oh, this is OCD. I do need help, but this isn't who I am. I'm not going to do these things.
Of course.
Yeah.
I always tell my clients, thoughts are not facts.
And I thought they were, I think.
Exactly. We turn it into facts, and we kind of even look at ourselves from
Yeah.
this lens.
Yeah.
But it's amazing also I think, shout out to all husbands who are supportive.
Yeah. Massive.
Right? I want to, maybe you can help us from your experience
Yeah.
to explain how important the husband role, the father role that
Yeah.
can get quite often neglected.
Yeah.
I remember seeing your husband
Yeah.
holding
Yeah.
your daughter, and he was there in every appointment.
Yeah. And he was
beside
also
you.
terrified because he didn't
seemed
understand.
exactly. He
Yeah.
was exhausted as well.
Yeah, he was.
Isn't it?
Yeah. And unfortunately, I had medication to help me sleep after this. So because we were bottle feeding, he was up 2 times a night to bottle feed for weeks. So he was, and working. He was exhausted. So like he's my hero. He really is.
Oh, wow.
But I think husbands are neglected, and they need someone to ask if they're okay,
Yes.
because they're not always okay. And I think they are carrying things. They're separated from it. They haven't given birth. They don't have to breastfeed. They don't have the come down, the hormonal shift that women do. But they've still been through it. And sometimes it's traumatic for them to watch their wives give birth. And when I was in England, no one rang my husband and said, how are you doing after that? Are you okay? Are you all right? And I think he probably needed someone to ask him that, and to be like, it's okay to feel exhausted. This is what you need to do. I think there needs to be more for them.
Oh, thank you. Actually, this is an eye-opener.
Yeah.
I think,
I
because
feel like it could be a whole other...
it can be what we know. Again, you said something about the research and evidence. We know from evidence that 10% of husbands of women who struggle with postnatal depression, they have postnatal depression themselves.
Yeah.
So it's it's important also to think of fathers, to think of husbands, because they have a role in the families. We can't just, we have to be holistic in healthcare systems. We have to.
And I mean, I reached out to get therapy, and because we are a very open couple about our emotions and about feelings, and I'm very aware that, you know, it's not just me. And I said, you know, you should speak to someone because, yes, I'm going through this, but you are listening to all the thoughts that I am having, and you can't just not speak to anyone about this because this is also scary for you. So through the company that I went with, he also seeked therapy, and that massively helped him.
So within the same clinic, within the same healthcare system, you manage both to get help. That's very wise of you, Catherine, also. It's very wise of you that it seems your eyes were open to everyone's needs. To your husband,
I mean, I just think
children.
He can't, I was struggling and I needed someone to talk through these things. And eventually my therapist said, you know, don't share every thought with him. But that was to help my OCD because that was my reassurance seeking. So it was, you know, say to him, I'm having a thought, or tell him the thought, but he then has to say, what would I say? Like, I know what he's going to respond with. So, but he was having to take on a lot. And I just thought, you know, he was also very exhausted and tired, as all new dads are as well. And so I just thought, you know, this can't just be about me. This is his journey as well. Yeah. So we both went through it.
Wow. Oh, that's really, really, you're very brave, Catherine. I have to say, you're wise and brave.
Thank you.
You said something, I think, very important for people to understand quite a couple of times about the reassurance seeking.
Yeah.
So if you can explain to us, what is that? What is reassurance seeking? I always explain it to my patients that, you know, your thoughts are intrusive, they are coming and going, and they cause physical sensations in your body. They are unpleasant. So to avoid that, we start to do things. Yeah. Whatever that thing is. Yeah. To help the thought kind of neutralize it. But within this process, we need this person to tell us everything is going to be okay, or we avoid certain people or certain places or certain conversations, or we check online, we check on ChatGPT. So we need always, some people just, even for them, reassurance is like a keychain, or reciting certain verses or certain words. It can be so many things that we call them safety behaviors. It's behaviors to help us feel safe, but the problem is we feel reassured for a while and then
the cycle continues.
The cycle. But I'm sure you will explain it better because you have lived it. So tell me more about, I guess, this reassurance seeking, and how did you break that cycle?
Okay, so I guess I never broke it for when I had my health anxiety. I was told about safety behaviors, and for me, it was carrying a bottle of water and chewing gum. I needed them. Everywhere I went, I had to have them, because if I felt sick, through the panic of anxiety of whatever it was, the chewing gum would make me feel less sick. Water, just in case. And I never got over that at that point. But now, probably for over a year, I haven't carried water. I haven't taken gum anywhere. I've gone on flights without it, and flights was a big thing for me. But for this reassurance seeking for my OCD from giving birth, it was checking with my husband. Am I going to do this? It was Googling. A lot of Googling about, like, is this psychosis? Like, could it turn into psychosis? Like, even a few weeks later, it was still. But what my therapist said, and what I read on Pinterest, actually, Pinterest had a few quotes that have really stuck in my head, was that to break that cycle was, if it feels like a threat, it's not a threat. So I would suddenly have this thought of, like, am I going to throw my baby? And it would, for me, it was in my chest, the panic. And I'd be like, okay, I can feel my anxiety, so I know it's not real, it's not me. So I just have to sit with it, which was the hardest thing. So my therapist at first was like, you know, have a cup of tea, but don't try and, I always tried to, another reassurance seeking that I did was tell myself I'm not going to do it. Kind of fighting with my own thoughts in my head. I was trying to battle them. So that's why it was always, nothing was very physical for me. It was all in my head.
And it was like a battle.
Yeah. And I learned to just sit with it. And it was the hardest thing because my hands would be tingling. I would be shaking. I felt sick. But I'd normally be holding my baby. That's when it would happen. So instead of handing her over, I had to learn to just stay there. And it got to the point where I'd be like, oh, I really want this feeling to stop. Like, it was so uncomfortable. But I knew that I had to just sit with it because I had to make my body realize that when I had one of those thoughts, it wasn't going to do anything. And I had I'd made it so important. I'd made the thought important and meaningful when actually it wasn't. It needed to be a throwaway thought. So it's like, we need to retrain this into, oh, what if I throw my baby? Oh, whatever. I think,
it's the whatever and so what.
Yeah, I needed to get
life.
that back. Yeah, instead of I am a danger, I am going to throw my baby. And the physical sensation was the hardest to fight.
I imagine.
Because it felt like I was just going to,
of course,
throw her out of my hands. And it felt like a dangerous thing to do to keep hold of her. But at first it was like my mother-in-law or my mum or dad or my husband would be sat. I'd be like, please just stay with me while I get through this. And then I remember once my husband walked away and I was like, I'm still feeling this uncomfortable feeling like you've left. So I was like, no, you just got to breathe, sit through it. And it went away. And over time, that feeling was less and less. And then that's when I started to realize I just have to keep doing this. And another thought that would come is, I live in an apartment. Oh, I'm going to throw myself over the balcony. It literally just picked up on all these different things. So I had to take myself out onto the balcony, and sometimes I'd have to sit there for 45 minutes in an uncomfortable state of, I could physically see myself hurling myself over the balcony. But I just had to sit with it.
And you didn't want to do it.
No.
This is very important.
Yes, that is the important thing.
You didn't want to do it.
I didn't want to die. I didn't want to,
You didn't want to die. You loved your life. You loved your husband.
And that's where
children.
The panic helped.
Exactly.
Because I knew it was the opposite to what I wanted.
Exactly.
And I would be crying to my husband, being like, I'm thinking of throwing myself over this balcony, but I do not want to throw myself over this balcony.
You were very clear that you don't want to.
No.
And that's where exposure helps. You know what you're saying, Catherine, and I think it's very important. That's lived experience. She confirmed that it goes away.
Yeah.
Right?
It
You
does.
confirmed
I don't
that.
have that now. I can go out on the balcony, hang my clothes up.
Wow.
I don't feel panic. I don't.
You know why? I think it's amazing moments here, because I think whenever I start to explain exposure and whenever I explain, okay, that's OCD, and it actually goes away.
Yeah.
When we do quite the opposite, when we stop avoiding, when we stop the reassurance behaviors and we sit with difficulty, I think I can evidently see my patients getting no.
Because you want to get out of it.
You want to get out of it. And in fact, even statistically, many patients drop out of therapy.
Because it's safe.
Exactly. Whenever they start this part, the exposure part. So we do the thinking part, the thought versus fact part, the feelings part, the tools to relax. But when it comes to exposure, people start to reschedule further. They don't want to do it. It's scary. And I understand it is.
It's terrifying.
But your message is very strong today, because it wasn't easy for you as well. Took time. It went away.
And obviously my therapist helped, but it was me.
Of course.
I had to do it. No one was going to fix this. No one was going to make it go away. But I think for me, one big thing, like for a mum, if I didn't fight it, my relationship with my child was going to suffer, because I would have given her to my husband and I would have been like, it's okay, you just do it.
So that was your motivation. That was your value. That I want a relationship with my daughter. I have to fight this.
And it made me question my love for her. I remember saying, my therapist said, what do you feel for Margot? And I said, I don't know. I said, I don't think I love her. But yet, it happened very quickly. This was probably just like a week ago. I'd felt fine. And I knew that I love her, but I I could not remember any of that. And so then I remember, you know, a few weeks I'd practiced. It felt like sort of training for a test. I had to practice it and I had to do these things in order to feel better. And I remember she asked me again, how do you feel about Margot? And I was like, oh, I love her so much. And I was like, I'm so sad for 3, 4, 5 weeks ago me that forgot. It made me doubt massively.
It's the overwhelming
Yeah.
as well. You know, when we're consumed with so many thoughts, it's really struggle. You described it beautifully. You were in this like tug of war with your mind.
Yeah.
But finally you decided to let the rope. And it wasn't easy.
No.
You had to experience difficult feelings. And I think that's the essence of human struggle when we talk about mental health. And no one wants to feel distressed.
But you have to not fight it. You can't. And that it didn't just I didn't just go, oh, I'm going to just sit with this thought.
Of course.
I failed a few times and handed her over because I couldn't. But I realized that the more that you fight it, the more that you fuel the OCD. And have you seen Inside Out?
Yes.
The film?
Yeah.
So for me, I created like a little OCD character. So there's obviously, in the newer one, there's anxiety.
Yes.
There's, I can't remember the other ones. Shyness, maybe, I can't remember.
Shyness.
But
anger.
So I was like, right, this is OCD. This is a separate little character in my head. And if I keep fighting against it, it's just going to get more. So I need to be like, I'd be like, one of the things that my therapist would say is stop. This is OCD. This is a thought. And so I almost imagined it as a little person being like, no, I'm telling you to stop. I don't need you right now. And that was another thing that was just a good little, like, as soon as I'd have that thought, I'd be like, no, I'm going to ignore you. We're going to just carry on living.
Control.
Yeah.
You took control.
Yeah.
The true control. Because OCD gives us a full sense of control.
Yeah.
It's a full sense of security. It's
Yeah.
a full sense of responsibility.
Yeah.
But when we actually take control, sometimes taking control sometimes I always say, like, sometimes more is less.
Yeah.
It's just doing less and staying with it for a while.
I think that's the worst thing. You have to stay with it.
Yes.
And that's the hardest part. But I think once people can sit with it and get through that, it is less every time. The anxiety is less every time. And then eventually it's just gone. Like, I'm the best I've ever been in 16 years. It's the best I've ever felt mentally.
You, Catherine.
And because there was just a switch. I was like, okay, you can't fight it. And I'd been fighting and trying to make it better, to try and stop that anxious physical feeling inside. And once I realized that was keeping it going, like me Googling, seeking reassurance from my family, my friends, my husband, that's what was making it worse. And it was just a spiral. And I had to stop that. And it was to sit with it.
Wow. And if someone there, I imagine a lot of people will be listening to you today and say, oh, she did it.
Yeah.
If someone is there now, distressed, anxious, and finding it difficult to sit with it, scared from the thought.
Yeah.
You have been there. What would you tell them?
I guess one of the things is it's not going to happen overnight. It's not going to instantly happen. And you can't be hard on yourself like, oh, well, she did it. I can't sit with it. But I think it's finding a way to sit with it. So for me, it was, okay, I'm having a thought right now. I feel panicky. Let's go and get a cup of tea. Sit down. Carry on watching the TV. Or, I don't know, get Sudoku on your phone.
But not Googling.
No. Just a distraction or just carry on. Just carry on doing what you were doing.
Life.
If you're on the bus and you're listening to music and it happens, just keep listening to that music. Because for me, if I was panicking, I'd want to get off. I'd want to find a way to feel safe. And it's about just sitting with it. And I think that it's so hard. It wasn't easy. It was the hardest thing I've ever done in my life. But it's massively changed my life. But it didn't take me 16 years. This time it was different. The therapist was different. the therapy was amazing because she taught me things that I hadn't been taught before. And then also reading these 2 books changed everything. Can I say the books?
Yes, please.
So one of them was Overcoming Unwanted Intrusive Thoughts, and the other one was Breaking Free from OCD. And I read them both like in a week. I just was like, I wanted to learn. I wanted to understand what was happening. But within that, and like you say, there was OCD for sexual thoughts, and I skipped over it. I didn't have that.
Yes.
But for people who say do have that, incredible to see, because that must be terrifying as well. Then there was the religious thoughts. Then there was the harm. And again, the main message was you have to sit with it. You have to be uncomfortable. And like you say, exposure. You have to hold your baby. You have to stay on the bus. You have to change their nappy. You have to be uncomfortable.
To be comfortable.
Yeah.
But being comfortable comes. Recovery comes.
And it didn't
there.
take that long for me.
It didn't.
And because it came on very hard and strong and fast. And I would say within 6 to 8 weeks, before that I felt better. I'd say within 2 weeks. I had the worst week of my life. It was the worst. And thoughts got very heavy and very strong. But then suddenly I was like, oh, actually, I've done these things and it's okay. And within like 3 or 4 weeks, I felt better. Within like 8, 9, 10 weeks, I was like, oh. And I was also on medication, and they're not meant to kick in for 12 weeks. And I was like, how can I even do this for 12 weeks? So you have to do, like, it's fine to have both, but you have to work. You can't just rely on the medication to help.
And you did that, and you did it brilliantly. And now you're talking about it. Everyone's, I can't thank you enough.
Yeah.
I think it's important to touch base on medications as well.
Yeah.
You know, it's scary for so many people, especially in the Middle East. Also, it's even more scary.
There's a stigma to it as well.
Very, very big stigma to it. I think it's what you're saying today, highlighting something important to me, Catherine, that getting the right assessment, the proper diagnosis, not as in a label, as in just understanding, having a name to my struggle that makes sense, that resonates, because that will, again, kind of draw out or map out the treatment, whether with medication, therapy, even the books you can read.
Yeah. And I think it's also getting the right therapist who knows what OCD is.
Of course.
And not just anxiety. And I was very lucky that my therapist dealt with postpartum OCD.
Yes.
And that the clinic was for maternal mental health. Like, I was steered in the right direction.
I have to say, her name, Charlotte, is amazing.
Charlotte
we
is
need
incredible.
to shout out to Charlotte.
Charlotte, you are amazing. I love you. Yes.
She is amazing.
Yeah.
And I think, thank you for highlighting that as well, the idea of a specialization and expertise. Yeah. Because sometimes we Google and we find, life coach. They are amazing and they are doing a great job. They might not have worked in clinical setting where they saw OCD, which is quite severe form of anxiety, and it has its own, you know.
And I hadn't found the right therapist. Like, I've had this for 16 years and I've had therapy. And there's bits that I remember from my last therapist that help, like the sitting with it. But she went down a different route quickly. It was the small part of it, and so it didn't stick with me. And so it is finding that right person who knows what they're talking about.
Knows it clinically, knows it from experience, from subspecialty. And again, in your experience, it was also like there was the motherhood.
It wasn't just OCD.
It wasn't just.
It was postpartum perinatal OCD.
Which means we need someone who knows actually the changes in your body, the fact that you have to hold your baby. Oh wow, that's amazing. And now medications. The taboo, big taboo. Tell me more, how did you feel about taking medications? How did it feel when you took the first pill? And
I was terrified.
You were?
And I think I was a bit judgy about people taking medication, but more not that they were taking it, that they don't do therapy alongside it. I don't feel like it should be for mental health, I don't think it should be an alone
Definitely.
thing, because it just is going to cover it. It's not going to get to the root of the cause. Like, it's a bit like, you know, if you had a problem with your leg and you just take medication, it's not going to fix it. It's just going to stop the pain for a while.
Oh, I love this metaphor.
Yeah.
Because honestly, when we have a broken leg,
Yeah.
yes, we do the casting.
Yeah.
We take analgesics.
Yeah.
We might need calcium supplementation and vitamin D supplementation and make sure everything is right on the biological aspect for good healing.
Yeah.
But then we need to do physiotherapy.
Yeah.
Or we will have...
and no one judges that. Everyone's like,
no
oh,
one
you've got a bad
judges that.
leg. Okay, you're taking meds for it. Fine, great. And
and do
also,
your physiotherapy and go for exercise.
Yeah.
And
It was my dad actually that said it. He was like, you know, my mum has Addison's disease and she has to take medication to stay alive.
Yeah.
That's what she has to do. And no one's like, oh, you're taking medication for that. But when it's your brain and when it's mental, people are like, oh, really?
maybe because it's unseen, as
Yeah.
you pointed out
And
earlier.
it is more of a stigma. It's like,
so much stigma.
Yeah.
Although medications save lives.
yeah. Why should it be different that you take medication for your brain when it is part of your body and it's something that you need every day? But yeah, I remember taking the first tablet and just being like terrified. And I did get some side effects. It made me feel a bit tingly, which didn't help my anxiety. And I remember ringing or emailing my psychiatrist and being like, is this okay? Like, and obviously I was still in the very much reassurance seeking side, and my health anxiety was like raging. But it didn't last very long,
Yes.
a couple of days. So it's like, get through that. And then there was no side effects. Fine. And I'm still on it now on a lower dose than I was. And I don't feel any shame to that. I remember laughing to someone who said, while I'm on my medication, you can get me to the boat party, because I was always scared of being on a boat in case I felt sick. So I was like, while I'm on the meds, let's do the boat party because now I'll go on it now. But obviously it's not that. It's me. I have changed
Of course.
as a person, but it did help. It must have helped. And because I tried to come off and didn't feel, I felt a bit wobbly. But that was just after 6 months. And my psychiatrist said, you know, normally it is a year that we say
Yes, true.
to keep it steady. So that was at the 6 months point. And I was like, okay, we'll go back. But I just didn't go as high. I was on a lower dosage. And I was like, okay, this feels, he said, you know, how do you feel out of a 10? I was like, an 8 or 9. I feel good. So it does help. But it has to be alongside therapy.
Of course.
You can't
Of course.
just do the medication.
You know, when we were doing our exams, like our board exams,
Yeah.
always, like whenever we're asked about treatments plan,
Yeah.
we have to say biopsychosocial. It has to be
Yeah.
in mental health. Not only in mental health.
Yeah.
Again, it's in everything, in hypertension, in diabetes, in anything related to the body.
Yeah.
Human beings are complicated. We
Yeah.
are not just body. We are not just brain. We're not just neurotransmitters. We are souls. We are relationships.
Yeah.
We're a being.
Yeah.
That is very, very unique.
Yeah.
And we have to respect this uniqueness in healthcare systems
Yeah.
by thinking a biopsychosocial. It's not this alone or that alone. In my experience, combining them would be the best.
Yeah.
People do stay in therapy for years, and sometimes medications make therapy quite faster and
Yeah.
make sense, you know?
Yeah.
And on the other side, also, people can be on medications alone, but they don't deal with it.
Yeah.
They don't sit with it.
Yeah.
They don't. So where are we going with that?
Yeah.
So it's always like it's a puzzle that has many pieces.
Yeah.
A piece for therapy, a piece for medications, a piece for relationship, a piece
Yeah.
for supporting the supporter, supporting the caregiver.
Yeah.
It's so many pieces.
Yeah.
For what we all aim for, recovery.
Yeah.
So
And
let's
I guess
talk a
there's
bit
no
about that.
shame about having the medication. I think that's it, that people, you know, yes, you don't need to talk about it to your friends, but if they know, then it
So
doesn't
what?
matter.
It doesn't
And-
mean that, oh, I'm addicted to it.
Yeah.
Because this is another fear of psychiatric medications. You know, they say, this is for your brain. It works on my brain. It will change my brain.
Yeah.
And I will be used to it. It doesn't change your brain. It
No.
changes just the neurochemicals
Yeah.
or the part of your brain that might be affected from prolonged anxiety. and it doesn't also make you addicted,
No.
because I have never heard of someone addicted to their antihypertensive medications,
Yeah.
but they need it.
And it hasn't changed me as a person.
Right?
Like my husband was like, you are the best version of you,
Oh,
which feels great. And I remember when he first said it, I was like, that's great. That's what I
Right.
want. And like, if medication means that I get to be the best version of myself for him, for my children, for myself, and live a better life because I'm not scared to go on planes, hold my baby, whatever it is, then I'll stay on it. Like it's not a bad thing.
it's not. Oh, it's really refreshing to hear you say that.
Yeah.
Because I think also coming from like doctors, it's sometimes just want me to be on
Yeah.
medication. So it's really refreshing to
Yeah.
hear you saying that. I think it's important, and the question in my mind is recovery.
Yeah.
How is it for you? Like compared to this time, how would you describe your recovery now? And
I mean, now it's, I don't know, I am living my best life, literally. I still have thoughts, don't get me wrong. It hasn't gone. Every now and then, it's not the same. Every now and then I'll go out on the balcony and there will be a thought. But I don't think about it. I feel it sometimes and I just kind of go like, I can't believe I ever believed that. So I can laugh at it and be like, yeah, okay, whatever. And then just go back inside, carry on doing whatever. And then every now and then I'll have a thought and I'll have to say, that's OCD. Not today, thanks. And then just carry on. And I think what helped as well when I finished with Charlotte was we wrote down a bit of a, like, moving forward, you know, if things get bad. But one thing that helped was to write down triggers. So like as a woman, hormonally, if I'm due on my period, my OCD is worse.
yes,
And I just
it
have to
happens
be
a lot
yeah.
to so many women.
Yeah, and I just have to be kinder to myself. And it is sometimes I have to work a little bit harder those days to, you know, ignore them. And if I'm very tired, I'll normally have a harder OCD day. But most of the days for me is OCD free. You know, my daughter's now, she's 15 months old today. Oh. So it's not a long time, you know, it's not been that long. And so I think it's just being kind to yourself and just, I do feel separated from that woman that I was, that had that experience. And I feel sad for her because she didn't have the information that I have now. And she couldn't see how it was going to be better.
Yeah.
And I think for people out there who are in it and feeling it the hardest right now, I think it's like knowing that it's going to be okay if they can get the right help and they can sit with that uncomfortableness to be comfortable, like you say, that it's going to be okay.
Wow, thank you so much. Thank you so much, Catherine, for being here today.
Thank you.
For
Because you also
sharing.
saved my life.
Oh,
You're also my hero.
oh, thank you so much. Oh,
Yeah.
you make me cry.
Oh, no.
No, thank you. Thank you so much. I'm sure you saved so many people just now.
I hope so. If I could make a difference to one person, it would mean the world. Because if someone could do that for me, it would have meant the world. So hopefully.
Thank you so much for being here today.
Thank you.
And you told me you're writing diaries, so
Yes.
please, I'm expecting a book. Nothing less than that. A book, a podcast, something. You need to work on something.
Okay.
And thank you. I think I'm feeling it now, that how I think those stories is what keeps us also doing what we do.
Yeah.
Knowing that
You've made a difference.
Yeah.
Yeah.
Yeah. So thank you. Thank you for being here today
Thank
and
you.
taking the time. Yeah. النهارده كانت حلقة مليانة مشاعر، مليانة صدق. كاثرين قالت لنا اللي جوه قلبها من حياتها هي ومن تجربتها هي. فكروا معانا النهارده، انتوا تجربتكم ايه؟ ازاي هنعيش الراحة، الرفاه وسط الألم والتعب؟ لأنه الريكفري أو التعافي هو شيء موجود مؤكد، واحنا شفناه كمان النهاردة. شكرا ليكم لانكم بتتابعونا، وهنحط لكم في البايو الكتابين اللي كاثرين قالت عليهم. كلمونا اكتر عن افكاركم، عن مشاعركم، عن حاجات عايزين تسمعوها معانا، وشكرا لمتابعتنا.